roll.
Roll call. Bryant.
Here.
Philbrook.
Here.
Markley.
Here.
Maddox.
Here.
McKiernan.
Here.
Walker.
Here. We have before us the approval of the standing committee meetings from January 20th, 2015. Does anyone have any changes, additions, deletions?
Move to approve.
Second.
Motion and second. All those in favor?
Aye.
Any opposed? Passes unanimously. First item on our agenda is a resolution for a $200,000 grant for fiscal year 2015 for the Justice and Mental Health Collaboration. Who do we have to address that item? We have Lisa. We have Lisa.
But you got to appreciate the eagerness with which they came to the meeting.
Rather than myself introduce each of you, would you please state your name for the record and your title?
Yes, I'm Lisa Steinmetz, a fiscal officer for the Public Safety Business Office.
Chief Terry Ziegler.
Judge Kate Lynch.
And Mark Wiebe with Wyandotte, Inc.
Colonel Jeff Fuel Warden.
All right.
Major Solomon Young.
All right. Who will be taking the lead on this?
I will.
Okay. Proceed.
We are here on behalf of the police department, and we are requesting approval to submit a grant application for the fiscal year 15 Justice and Mental Health Collaboration Program. This would be a continuation or expansion of an already existing law enforcement and mental health collaboration plan. Again, the grant is for $200,000. There's a $50,000 match, which will be an in-kind match. This match will not affect the general fund of the unified government. It will be a percentage of certain salaries within the police department, I believe a major and a captain, and then some salaries and benefits of some employees with the Wyandotte Center.
All right, commissioners, questions? Is this a one-time grant?
Well, we currently have a grant, which is it's the Justice and Mental Health Collaborative Grant for 2013 fiscal year. This will be a new grant. It will be a one-time grant unless there comes an opportunity to apply again next year or year 2017 possibly, but this is for, I believe, a 24-month period.
And at the end of this grant, Chief, the benefits and salary, I'm a little confused. Maybe I didn't hear it correctly. Is this going to take the place of existing salary and benefits for those two officers?
No,
Or our match is the benefits and salary?
we're using the salaries as our match, our $50,000 match. This is part of it is it's a program that expands our current crisis intervention team. We're wanting to add another co-responder. We currently have a co-responder that goes out with our officers to deal with people who are in mental crisis. And then we would also, one of the goals that we have for the police department is to increase the number of officers that are CIT certified. Currently, we've got about 95 officers that are certified, and we've got about 360 that need to be certified. So this gives us funding to be able to put on those classes, up to three classes per year. And I believe by the end of this 2-year period, I think that hopefully we'll have 75 to 100% of our officers crisis intervention trained certified. The main thing this does is it enables us to be able to, when we run across an individual who's experience of mental crisis, rather than booking them in the county jail, the officers talk to them, evaluate where they're at, take them to KU, take them to RSI, and it eliminates us from booking the individuals, which that was the only tool that we've had in the past. There are some other programs with the courts that this also helps pay for, and I'll let Judge Lynch speak to that.
One of the problems that we have in the district court system is if somebody is a chronic substance, really, Joe, are you surprised I needed a microphone? If somebody is a chronic substance abuse individual, and they're in and out of the jail because of that substance abuse. That costs us all as taxpayers lots and lots of money. Part of the problem is there is not, because we're not a Medicaid expansion state at this point, we don't have the funds for substance abuse beds. This grant would give us about $25,000 to put towards substance abuse beds, so that when we call those folks who serve us in the substance abuse community, they know that we're going to be paying for that bed, and that frankly moves us up the list.
And how does this tie to the jail
Well,
and the sheriff's department?
I would like to take all the credit for everything that's been done recently to reduce the census in the jail, but I'm not going to do that, so I'm sitting with my community partners. Since RSI came online, since the officers have been crisis intervention trained, and I made some changes in my involuntary commitment docket, we have reduced the number of admissions to the state hospital by about 50% since RSI and the changes came online. And we've also, Warden can speak to the exact numbers, but we've reduced the number of folks that are in the jail suffering mental illness issues, which, as you know, the average prisoner is $92 a day. Those folks are somewhere around $115 to $135 a day. And we've reduced those costs to the jail.
Warden, do you have comments?
Commissioner, it's the old way of thinking was disorderly conduct, send them to the jail. Now there's options, and it's more of a trauma-informed care approach than a disciplinary, security, segregation type sending them to the jail. So it's kind of like it's a different approach that just so happens saves a lot of money. What happens many times, they'll come to the jail on a municipal charge, and they're mentally ill. And as you know, they can act out in those types of high-stress situations, and striking or spitting at one of our deputies is a felony. It's a level 5 felony. So immediately, instead of treating this individual as a municipal charge or in Judge Lynch's court, they now become a party to the criminal justice system at great expense to your government.
Is this program, is this program open to, I mean, do the sheriff's deputies participate in this program?
The crisis
Yes.
intervention train program? Absolutely.
Okay. Commissioner Philbrook?
Yeah, I appreciate you elaborating a little bit on how it's affected the jail. How do you feel has it helped with the men and women that work in the jail? Has it helped them a lot to, cut down on the stress and take off less time, all that sort of thing?
Yes, Commissioner. It's again, it's a different approach to how we manage inmate population. Before, it was the old school technique of using force. And now, and you're talking about using force against the mentally ill, the lower functioning persons, or suffering a medical crisis. The tools in the corrections officers, the detention deputies' tool belt usually were using force. And as we know, using force has a cost, both the workman's comp on the deputy side and potential litigation on the inmate side. So this CIT approach is again a trauma-informed approach that educates and trains the deputies to look at things in a different way, and maybe take into account and explain things in such a way that maybe we should use a different, if the person is deaf, if the person is suffering from Alzheimer's, maybe we should take these into account instead of immediately going to the use of force scenario. And so again, it's all about, the CIT is all about training our deputies and educating them on the symptoms and signs of mental illness so that they can use different forms.
So in other words, there's people would never make it to intake.
Sure.
They would be going to other locations first before they ended up acting out.
And even if they do go to intake, and they're municipals, which we have, because they've committed a crime and now they're municipally charged, the deputies can use IPC skills and de-escalation techniques taught in the crisis intervention team training, so that again it's a different approach instead of going straight to the using force. And with deputies, it's a light and dark, it's black and white. So we have to teach them, okay, and show them that there are reasons, there could be reasons for this type of behavior, and this is why. And then so then that gives them, a different, okay, they understand that, they get it, and so that they have the signs and symptoms, and then they might give this a second look, or use a much toned down approach than going straight to using force.
Thanks. I would like to know if there anybody else sitting there in the crew that has anything that they want to say that we haven't really heard yet from anybody here.
21 years ago, I was a municipal court prosecutor, right down on the second floor. Commissioner Walker was my boss. And there was nothing more frustrating for the officers or for myself than seeing the same person charged with the same crime, sometimes with the same victim, the same store owner where they were loitering or they may have shoplifted, and not being able to do anything about it. With the programs that we have in place now with the CIT officers, the co-responder, RSI, my courtroom changes, we can now treat the issue, the core of the problem, and not just the symptom. And I think it's one of the few times we get to we save taxpayer dollars, and we do what's right by the human also.
Anybody else?
Any other commissioner?
No, I move that we submit the grant.
Second.
Okay, we've had a motion and a second. Roll call, please.
Roll call, Bryant,
Aye.
Philbrook,
Aye.
Markley,
Aye.
Maddox, McKiernan,
Aye.
Walker.
Aye. Thank you all very much.
Well done.
Good luck.
Thank you.
Thank you.
Second item on our agenda tonight is the Public Works presentation of the 2015 mowing program. I'm sure this promises to be very entertaining.
And very quick. Good evening, Commissioners. As you directed us during the budget process last year and again during strategic planning, you wanted changes in the mowing program, specifically how we maintained our own UG Park property. To accomplish these changes, you increased our funding. I have with me Jeremy Rogers, the new Parks Director, his assistant Jack Webb, and of course Tim Nick, that you know from Public Works staff. Jack and Tim have been working on this. I will now turn it over to them to tell you about it. When they finish, I'll discuss a conversation I had with our HR director and how we would go about hiring the summer help part of this operation.
As Mr. Tobin said, last year the main concerns at budget time with our mowing program that the commission came back to us was, first of all, a need for a better overall maintenance of our parks and mainly our UG properties. A lack of trimming and cleanup in the parks, our fields, and that areas. And again, an emphasis on the UG properties only, and also with the contractor that does the medians along State Avenue parallel, the detail there as far as the cleanup and the trimming in that area. So what we've done, like Mike said, it's your directive. We were given an extra $55,000 funding this year, and we talked about it, went over what the best scenario would be, and we believe we'll be able to hire 12 summer kids, and those kids will be able to work 12 weeks for us. Most of them are going to start out with the park department. probably all of them to start with. And they'll be able to be moved back and forth between parks and streets. But since the emphasis is on parks, we're going to start mostly with them. That's also going to allow us to buy some additional trimming and cleanup equipment needed. We also, Jack and Jeremy, when they went out for bid this year, they changed the scope of services for the median and the parks contractors as far as what they're required to do as far as their trimming and cleanup as compared to in the years past. Another big change with the park department is that they're going to have one dedicated staff person who his responsibility is to check up on all the contractors to make sure that they're doing what is expected of them. And then finally, starting this spring, the park department is implementing a 3-year spray program for the medians along Parallel, State Avenue, and those areas. And then finally, this is an updated chart. This is the same chart that we had last year, but updated with the numbers that tells about all the areas that we have between parks, streets, and our various contractors and the number of lots that are mowed within the area. And that's what we have. Let's open it up for questions.
So, you say you're gonna talk at the end about how they're gonna be hired. So that's great, because I know that one of the other commissioners present really wants to know about that. Now, so you said you changed some things about the contractors for the medians this year. What kind of changes are you talking about?
The things we changed was the frequency of the mowings, the trimming. We have a lot of problems, even the park staff itself, where our mowers can move faster than the trimmers. So we emphasize that. More edging. That was a big concern last year. So
How many contractors do we have right now?
we had 6 last year, and we dropped to 5 this year.
Okay. All right. Remains to be seen what happens, right? By the end of the season. I'm not going to prejudge because I don't have a clue how it's going to work.
Ultimately, we're trying, Parks Department, we were on a 14 to 17 day turnaround. We think we'll get down to 10 to 12 days now, and the contractors are on a 7 to 9 day turnaround.
Okay. So those medians should look really nice, huh? Now, are they responsible for watering too on the ones that still have to be watered?
Just mowing.
Just mowing. Okay. Because I know, so you guys do the watering then?
Park staff.
Okay. All right. On the ones that have to be, the ones that have the median water already included.
Yes.
And the updates further west will be automatic. Okay.
Hopefully.
Yeah, I know. Thanks.
Yeah. Commissioner?
Yes, thank you. I wanted to know who will be monitoring the grass cutting during the summertime. Is it a certain person or?
Yeah, we have a park staff that's his full-time job is to monitor all the contractors.
Okay, and then my other question was, are there stipulations we're putting this year on grass mowing in vacant lots where there may be trash, debris? Because often, and I've spoke up about this 2 years out now, where people just run the mowers in, run over the trash, tear up a bunch of stuff, and the grass will be cut, but there's a lot of debris left in the open vacant lot. So, just kind of.
Park staff, we currently have 1 person in mowing the lots. With the addition from summer kids, we're going to up that to 2 full-time park staff on lots. And the contractor that does our other half of the lots, he has 6 guys.
Okay, so but I'm saying, what will we do different this summer that will stop us from just mowing grass and leaving debris and trash and vacant lots?
We have more people
Okay.
that can do that.
Okay, so you're saying that we will probably go through the fields and pick up the trash first before mowing?
Yes.
Okay.
The addition of the summer help commissioner will allow regular park staff to assist in that part of the lot mowing while the summer help is working on the actual UG Park property. We took the emphasis from your direction to be that this additional money was to help with the trimming, the edging, and the cleanup in our parks, specifically the ones that our citizens use on a day-to-day basis, walking their dogs, playing, whatever. And that was the concentration that we gave this. And putting those kids in there, I shouldn't say kids, putting the younger workers in there should allow the park people to go ahead and do that.
Okay. And are we still doing what we call eco mowing, or have we come up with something where we can grass cutting mainly the Jersey Creek area?
We stopped equal mowing.
Huh?
We stopped equal mowing 2 years ago.
Oh, okay.
I'm not a big fan of that.
Me neither.
If there's no other questions, I spoke with Renee Ramirez, our HR director, today, and we will hire these additional workers as part-time summer workers, and it will post on the last Thursday of the month, which I believe is the 26th, for 2 weeks. After that, then the applications will come to the park department and the street department. We will conduct interviews and proceed from there.
Is there something you're looking for when you do the interviews?
I'm sorry, Commissioner?
Or, okay, and I apologize, so I should have.
No, go right ahead.
Okay, when conducting the interviews, is it something specific you're looking for from teenagers during the interview?
Yes, I took the direction of the commission, especially from several of the commissioners, to put some of our younger citizens to work, like we used to do when we had a full-blown summer program.
Right, and I was one of the ones who mentioned that, but I just wanted
Yes,
to
you
know, when you say interview, I mean, what exactly is the process in that for a teenager who shows up and just says he wants to cut grass?
Well, you still like to bring them in and talk to them, get a look at them, and say, and again, we don't know how the response will be either, Commissioner. You know, and in the past, having conducted interviews for the summer program, sometimes they walk in and you think they're coming in to mow, but that's not what they're coming in for. So you have to make sure they know what's going on.
Okay. And
It won't be the typical process that we use on regular employees or anything like that, but it's still, you have to bring them in and talk to them.
okay. Do we have a rough estimate of how many teenagers we'll be hiring?
12.
12.
Minimum wage?
Somewhere in that or more, Commissioner. I don't know exactly where the salary will be. That's something that Renee and I discussed today, but that would ultimately be up to Doug.
Any other questions? Sounds good. Doesn't appear that there needs to be any action taken. Be nice not to have any complaints from our constituents this summer about grass.
Well, if I can say one thing, Commissioner, I don't think it would be possible for our crews to have to mow as much grass as they did last year. Jack, we were still mowing in December, weren't we?
Hey, has the
Very good
idea
year
ever
for
been
grass.
raised on some of this vacant lot property about herbicide use of like instead of cutting it 3 or 4 times, taking a quart of, that kills everything green on there and not having to do it again. I mean, it seems like that issue has come up, and I don't recall why there was a problem with that. Is it EPA related, or?
Well, there's actually 3 of them, 3 problems with it, Commissioner. One is the regulations and the EPA. 2 is the expense of the chemicals to do that, because
Cheaper to cut it than to kill
none
it?
of, well, it used to be, and none of the departments that actually parks or streets had budgeted for it. And the third thing is, in some of the areas, if you go in there and spray it and remove all the foliage, you're creating drainage problems.
That makes sense.
Yeah.
Thank you very much.
You're welcome. Thank you, Commissioners.
I have one though.
Board Member Bryant?
So dovetailing off of his conversation, what about if neighbors want to like use it for garden areas?
There's a process for that, Commissioner, that we have. A lot of times with the land bank properties, that happens. With the ones that are still in the UG title, they can come before the commission and ask to do that. We have several neighborhood groups that do that.
All right. Thank you very much for appearing. No one
Thank
appears-
you.
Appreciate it.
I think it'd be appropriate for a motion to adjourn. Okay, motion and second. All in favor? We have 2 minutes, it looks like, 4 minutes.
5:15.
Oh, is it 5:50?
I was just gonna give them a minute to.
Well, then, I will turn it over to Commissioner Markley as Chairman of Administration, and you begin whenever you want.
No, we were slow. We're behind schedule. All right. I will now call the meeting of the Administration and Human Services Standing Committee to order. We want to welcome everyone to this meeting. Public comment is welcome. Anyone wishing to speak on any item on the Standing Committee agenda may do so when the item is up for discussion. You'll have up to 3 minutes. Please come forward to the microphone and you will be recognized. Would the clerk please call the roll?
Roll call. Philbrook.
Here.
McKiernan.
Here?
Maddox.
Here.
Walker.
Here.
Markley.
Here. Next, we have the minutes from our January 20th, 2015 meeting. Is there a motion for approval?
So moved.
There's a motion and a second. All in favor signify by saying aye.
Aye.
Opposed, same sign. The minutes have been approved. That takes us to our committee agenda. Item number 1 is a grant application to fund a comprehensive food system assessment. Welcome.
Yes, this is Larry Franken with the UG Health Department. The funds for that are going to be used for doing consulting from a group at KU Medical Center to help us get a comprehensive study to determine weaknesses in our food system. This is tied in. We've already, I guess, add into that, we just recently were named one of 8 communities across the nation to receive a Community of Opportunity Award from Farmland Trust, which will give us technical assistance in assessing our food system, which, as you guys probably are aware, we're in grave need of support with understanding how we can get fresh fruits and vegetables to our residents.
Questions or comments? Commissioner Walker?
What would you expect this assessment for almost $200,000 to tell you?
Well,
What do you hypothesize the results of this is going to be?
the hope is they'll give us ideas of, one, where we have weaknesses, be it in transit systems to our groceries and to our corner markets, and also maybe they may also give us ideas on policies that we could implement that may encourage more development with grocery stores and corner markets in the community.
Additional questions?
Yeah, can I ask you a question? Okay. Yeah, you may not know this, but I just thought I'd ask you a question because it came across to me in my email. Do you know anything about the Fresh Food Financing Initiative?
I'm not that familiar with it. No.
Okay, we'll talk if you want to hang around later because it's something that came across. Thanks.
Commissioner Walker?
I got to ask you, what are the employees doing right now in the amount of $72,307 that's not going to be done while they're doing this?
So what are they doing? What they're doing as far as their jobs right now?
Yeah, I mean, they got to be doing something.
Oh yeah, they're actually working on other initiatives, which we're going to talk about here soon too. But from trails to the femur stuff, the fetal infant mortality stuff, to just education activities, health promotion activities in the community.
What does this represent in terms of,
Percentage of salary or?
well, actually percentage of job duties for these? I don't know how many staff you're gonna have working on this, but what is it, one full-time employee or?
It'll be both, it'll basically be 2 employees working part of their job it'll include.
Okay,
And actually, probably it'll be a lot, once we get into the process, it'll probably be a lot more of their time. I'm guessing probably 30 to 50% of their time will be devoted towards it.
okay.
There are no further questions. I'll entertain a motion.
Move to accept.
Second.
Motion and a second has been made. Roll call.
Roll call, Philbrook,
Yes.
McKiernan,
Aye.
Maddox,
Aye.
Walker,
Aye.
Markle.
Aye. Dr. Franken, I think you are up again for the grant for the 2020 campaign.
Yeah, this grant is a campaign we're about to start up here on 20 miles of trails, 20 miles of bike lanes, and 20 miles of sidewalk to the community through the, applying through the Healthcare Foundation of Greater Kansas City. And you can see there, oh, actually, I didn't pass these out. Here, I pass these. Here's a handout explaining some of the activities that we're going to include with the grant funds, which will include things like creation of a campaign, logos, websites, brochures, videos, to kind of show people what's available in the community on these trails, to encourage people to go out and use them, community events like a bike ride or 5K, and also we'd like to develop like clubs, walking clubs around those communities to encourage more activity.
Questions? Commissioner McKiernan?
So the grant is really just for promotional materials here. It doesn't include anything in the way of creating some of the 2020 infrastructure?
No, yeah, I guess this one is kind of we're just kind of the part to get us kind of started on the campaign with getting people encouraged and excited about wanting to be active and being involved in physical activity in the community.
Okay.
So yeah, that's kind of this part of that. We'll talk about it more in the next grant, but.
So as you said, then it's just for things that are already in place right now, and to encourage people to use what we have.
Yeah, use what we have now, so.
Okay.
Additional questions? If not, I'll entertain a motion.
So moved.
Second.
A motion has been made and seconded. Roll call.
Roll call, Philbrook,
Aye.
McKiernan,
Aye.
Maddox,
Aye.
Walker,
Aye.
Markle.
Aye. Item number 3 is a request to accept charitable funds from the Slide for Health contest.
Yeah, this was a fundraiser that was done last year at the opening of the new super slide there at Slitterbahn. Vericoot, right? Is that if I pronounced that right? I never know how to pronounce that. The money raised from that $9,468 is going to be used to help with, you can see we have a picture there in that handout I gave you, trying to improve the surface for Armourdale hike and bike route. As you can see there, it's pretty rough, and these funds will be used to help resurface that and also add some signage too.
Questions? If not, I'll entertain a motion.
Move to approve.
Second.
A motion has been made and seconded. Roll call.
Roll call, Philbrook,
Aye.
McKiernan,
Aye.
Maddox,
Aye.
Walker,
Aye.
Markle.
Aye. And item number 4 is another request to accept charitable funds from the General Motors Fairfax Assembly Plant.
Yeah, we received $5,000 from General Motors, and those funds are going to be used for an action team that's looking into our fetal infant mortality rate, which is a major concern here in Wyandotte County. I'm going to have some of my colleagues here speak on that subject to you briefly.
Hi, I'm Leslie Newton. I'm a registered nurse over at the Health Department. In January of 2013, 3 counties were given grants to start a fetal and infant mortality review program. Those counties were Gary, Shawnee, and Wyandotte. Basically what we're studying is the deaths of babies in utero, age 24 weeks or greater, and infants up to age 1. Infant mortality is an important indicator of the health of a community or a state. It serves as one proxy indicator of population health since it reflects the potential association between the causes of infant mortality and other factors that are likely to influence health status of the whole population. So basically the number of babies that we have die is a direct reflection of the overall health of our county. and we are one of the highest counties in the nation for African American infant mortality. Fetal and infant mortality review is an action-oriented community process that continually assesses, monitors, and works to improve service systems and community resources for women, infants, and families. It's not something we can solve overnight. It is an ongoing community initiative with recommendations that will be constantly changing and added onto based on the data and community needs.
Question.
Commissioner Walker?
I recently, a month or so ago, maybe longer, had a meeting with a prominent leader in the black community who has a daughter that works in this field back east, and made him aware of the infant mortality rate in the black community in particular. Do we have results over a number of years, or was this one year in particular in which there was a spike? I mean, has it consistently been the highest in the nation?
I don't have results any newer than 2010 at this time, but we do continue to be one of the higher counties in the nation up until this point. The number of births in Kansas has declined. So our numbers kind of look like they're going down, but in reality, our numbers are continuing to go up as far as the death rates go.
And the inequity has gotten wider over the last few years. It wasn't.
You have to speak to the microphone because they can't hear you.
I'm sorry. The inequity has actually widened over the last few years between the Caucasian and African American.
I would like, I'm sure all the commissioners would like, as much hard data on this as you can develop. I'm not wanting you to go out and spend a lot of time doing this, but surely there must be data that's somewhat readily available for more than a one-year period of time. I mean, we don't know what 2012 infant mortality rate was.
I can tell you how many babies died in Wyandotte County in 2013.
Well, a number does, 10 is a lot if you only have 100
Right.
births, but if you have 10,000 births, it's a different. I guess I have to know or have some quantifiable measure as to whether this
Right.
health disaster is continuing on a year by year basis, and what we need to do to make inroads into making that stop or decrease.
I believe on your handout that we gave you.
These things that were just handed.
No, the one that says the full sheet of paper. This one.
Oh, yes.
You have that one?
Obviously had time to read it.
Okay, no, that's fine, that's fine. So the first little bullet point, it says in Kansas, the black non-Hispanic 5-year rate of fetal and infant mortality, so from 2009 to 2013, is 2.7 times higher than the white non-Hispanic rate. So the black rate was 14.6 deaths per 1,000 live births. The Hispanic 5-year rate is 1.4 times higher than the white non-Hispanic rate. So Wyandotte County accounted for 104 deaths, or 8% of the total. So the 2020 health initiative was 6 deaths per live births. So the African American rate was 14.6. So pretty large discrepancy between the national average of 6.
Do they attribute these deaths to what cause?
That's the point.
We don't know?
That's the point of
Could you also
the
state your
fetal-
name for the record?
I'm sorry. I'm Terry Garrison, and I'm the program manager at the health department. And that is the point of the FEMUR program, the Fetal Infant Mortality Review Program, is for us to do, to basically do a continuous quality improvement program for the community to do case reviews, to do case abstractions and case reviews of those infant and fetal deaths, to see what kind of system gaps there were, what kind of resource gaps there were, what kind of issues came up for that family, for that mom, for that death, that we can look at it as an entire system and as an entire community and find that there are what things we can put in place to make improvements and to decrease that rate.
8% is totally unacceptable.
I would agree.
I would expect it to be maybe 1 or 2%, and maybe not even that, but 8%. All right, thank you.
Commissioner Maddox?
Thank you. Thank you. And I agree, Commissioner Walker. I would also like to see rough numbers and rough data that leads to it. I too myself seen the Channel 5 segment where they deemed Wyandotte County the highest county in the nation for infant mortality rate. And I couldn't believe it, so I started to Google it, started to do research on it, and I don't understand how if someone in some room is saying, where do the most babies die, they will pinpoint on a map Wyandotte County. And we can speak about poverty and all those different things that may be a part of the equation, but my question is, you know, there's other counties and cities in other states that are, or counties that are in much more poverty than Wyandotte County, but we still rank higher than them. So I don't know that it's really a poverty issue, but it may be more of a resource issue. And so my question is, with, you know, the health department being predominantly grant funded, you know, does that become an issue? You know, if there's not a grant there, if we don't get a grant, do we not have the services needed? You know,
It helps, obviously, yeah. I mean, the grant funding, the resources we can put into it helps immensely, yeah. But I'll say that at least there's a plan in place now to address it, through kind of what they're talking about, and now going on with the development of an action team to try to see if we can find ways to stop this. And I guess to your point, it is, there's areas in rural Alabama and Mississippi that are much more poverty stricken than us that have lower infant mortality. So like I said, it is an issue, and it is one that we need to probably focus on.
right. And so my question with that, I wanted to know, is it going to be a task force? Is it going to be a team? I mean, how many people are on this team?
We have, there's 4 steps basically to our FEMA process. We receive the either death or birth records from KDHE. The charts are then abstracted from hospitals or doctors' offices or whatever other sources we may need. There's a maternal interview process, which our social worker Jennifer does, and she actually contacts the mothers of the babies that have died, and whoever is willing to speak with her, she has an interview with them, getting their side of the story, what they feel like happened in their particular situation. Do you want to talk about that at all?
Sure, I gave you guys the folder. Jennifer Allen Cottle. There's one of these for you guys to pass around, but when we receive the information from KDHE, the death certificate, which Leslie gets, we send out this packet of information, and it explains what our program is. Because we had to go before an institutional review board, we are not allowed to contact the families before 3 months to allow them to have time to grieve. So we do want to give them information and let them know that we are available for them. We also give them information about where they can go in the community to receive grief support. Because a lot of times after something like this happens, families feel very alone. Which almost every mother or father that I've talked to after an incident like this feels like there's alone and they have no one to talk to. So we try and bridge that gap and give them information about where they can go. A lot of times actually what happens is they'll call me directly and say, yeah, I want to do the interview. And so then I go ahead and schedule the interview. The interview process takes anywhere from an hour to 3 hours. Sometimes I've had an interview take 4 hours. It depends on what that mom wants to share with me. Now, I do have specific questions that I need to ask about, like her prenatal care, if she had any problems with obtaining Medicaid or insurance or food. But we also talk about things like drug use, cigarette use, domestic violence, all of those things that happen. We also talk about the baby's sleeping environment if there was an accident. So far, all of the families and mothers that I've interviewed have been very open with me. We've found some very interesting things that we've taken to our case review team and have recommendations to give to the community action team. We have been very lucky. We've had interviews from very diverse families, different groups, different religions, and we are well ahead of the rest of the femur teams in the state as far as interviews come. We have had no barriers in getting the maternal interview.
Well, and thank you. And I would like, if possible, for the evaluation process to include environmental. It could be something that people are drinking. It could be something they're inhaling every day. You know, I know there's other things that could possibly be looked at as to why that's happening, located or centrally located in a certain area of our community. And so I don't know what that takes, but I think also we can look at the environmental effects. Because I've also read, you know, through high school where, you know, there was environments that were toxic, that people were inhaling daily, and they started to die earlier. You know, just different things happen. So, you know, maybe that's one process too.
So then once the maternal interview is completed, we have a case review team that consists of neonatologists, OBGYNs, pediatricians, clergy, EMS, coroner, nurses, SIDS, March of Dimes. We have a bereavement coordinator, healthy families. We've tried to cover as much as we could of the community, the health community, in our case review team. What they do is they review the charts, the medical information, the maternal interview, and then they make recommendations on what they think maybe could happen to make this better in the community. So those recommendations then go to a community action team, which is made up of a diverse group of community leaders. I believe there's about 20 members on that team. They have not met yet, I don't believe. I think they're planning to meet soon for their first meeting, and we're planning to give recommendations to them in May from the case review team. And then it's the community action team's job at that point to then put the recommendations into action.
Great work, needed work, well thought out, comprehensive. Let's get back to this particular gift. Remind me again, how will this specific $5,000 be used to facilitate the attainment of all these objectives?
It's going to go towards the community action team, so it's going to go towards the actions. It's going to help us put these actions into play in the community.
It's going to help with implementation or just support?
I believe implementation.
Well, some of the things we're talking about, like doing, to get people, encourage them to go, have, you know, food for them to come, daycare, to get the mothers, some of them to come there, so we can meet with them to try to implement some of these interventions. So part of it's going to be to, help get access to the community.
All right, thank you.
Commissioner Walker.
At the risk of zero would be the obvious goal, but what is considered normal or standard, or is there I would think that under the best of all circumstances, there is going to be an occasional infant death, if for no other reason than perhaps SIDS or some genetic defect or congenital heart condition. What is considered a normal goal, an attainable goal for a county? Do we have anything like that?
The Healthy People 2020 health initiative is 6 deaths per 1,000 births. So we would like to be below that,
Below
ideally.
6?
Yeah, 6 or below, yes.
Thank you.
And I would like a quick analysis, since this has been going on probably 3 or 4 years, where we've been ranking like dead #1 or somewhere in their top 3 across the nation. What have we found before this task force? What have we, in research, what have we found in the last 3 years that may be a common cause, that may be something that's a red flag? Where are we at in the process as of now?
I can tell you that the coroner tells us that there's a lot of sleep accidents. There's a lot of parents rolling over on babies, alcohol involved. When you look at infant deaths, that's the majority. So we do know that that is I will tell you that that's the hardest maternal interview to get.
You said parents using alcohol?
Sleep accidents, so maybe they have
Oh.
had alcohol and then slept in the same bed as their baby that night. So, you know, we're looking at things like cribs for kids, finding and educating parents about safe places for their babies to sleep. So I will tell you that's one of the higher ones.
And probably for the fetal losses, a lot of times it's stress. It's maternal stress. Maternal stress, and that can, I know, incorporate all kinds of things, but it causes inflammation, and then inflammation can cause preterm labor, preterm delivery, early babies, and then they're in neonatal ICU, and that can cause all kinds of problems, lung immaturity, and things like that.
I would like, and Joe, since you were formerly head of that health department for a number of years, we're going to go into our budget session here soon. And I would like to have, as part of that budget presentation for the health department, I'd like to see a proposal. I mean, $5,000 is nice, and I'm sure will take money gifted to us, but what else can we be doing and from a financial standpoint? More staff, more outreach, more private provider assistance. I would like to have a more comprehensive review of what we're doing in infant mortality than and not, this was fine tonight, but I mean, it is disgraceful to think that we are the worst in African American infant mortality. If you'd have asked me cold blank, I probably would have said Detroit. I mean, just because of all the other issues in Detroit. But this is not acceptable, and $5,000 is nice, but we need more resources at this if we're ever going to bring that down, I think. And I'm not sure what those resources are. That's why I'm asking for some kind of more comprehensive aspect at the budget session.
We can certainly provide that. This has been, you know, we're very good with grants, as you're well aware, and but we can certainly provide the funding source for FEMA, how long it's going to be in place, which would be for just a few more years, and then what it's going to take to continue it, because it is a staff-intensive, very laborious process, you know, to work through this. So we can certainly provide that for you. What would it take to? What are we spending on FEMA now, and then how do we solidify that in the health department into the future?
We need to take the results that we're getting as to what happened post-death and translate those into some kind of effective pre-death outreach program to pregnant women that, I mean, it seems simple when you say it, but with this kind of number, it is very clear to me we need to be doing more than we're doing, and the sooner the better.
I think that's a great point. I think the what's going to happen through this process at the health department is going to really, we need to engage the community even further to help address these issues. I mean, the health department can't be the be-all, end-all for fetal infant mortality reductions in this community. What we're going to be doing is raising the profile of these, and they've mentioned a couple of examples of what does happen or what could happen, but we really need to wait until they get their interviews done and figure out what's happening in our community. That's the difference. We could generalize and take all the different scenarios, but we want to get real numbers from those interviews, and including things like the environment and the other factors that go into play. So what they mentioned tonight is great, but we want to see what these families have actually experienced before we come back with a recommendation.
Very good discussion. Do I have a motion and second for this to accept these funds?
So moved.
Second.
Roll call.
Roll call. Bill Crook,
Aye.
McKiernan,
Aye.
Madden,
Aye.
Walker,
Aye.
Martin.
Aye. Thank you all very much. Dr. Franken finally gets off the hot seat. Item number 5 is a request to fund the 8th Street Family YMCA. It says it's being presented by Gordon Criswell, but the man approaching me doesn't look like Gordon Criswell.
I think I'll start with the introductions. Gordon,
All right.
Gordon wasn't feeling well this afternoon, so he headed home. But this is a presentation from the YMCA staff. I'll let them introduce themselves about the funding that they have received from the unified government in the past, what's been happening with that funding, and the community impact that they've had at the 8th Street YMCA. So with that, I'll turn it over to the Y staff. You guys can introduce yourself to the commission.
Terrific. Well, very much. Thank you very much for the opportunity to be before you this evening. My name is John Mikos. I'm the Executive Vice President and Chief Operating Officer for the YMCA. To your right is Scott Clark. He's our District Vice President. He oversees operations for all of our Ys in Wyandotte County. And Joanna Rogers, to your left, is the Membership Engagement Director for the 8th Street YMCA. Tonight, who's not here, is David Bird, our CEO. He's actually traveling out of town with our board chair to be involved with the National YMCA event, including meeting our new National YMCA CEO, Kevin Washington. Also, Simeon, who's our executive director for the 8th Street YMCA, also not able to be here this evening. He's actually traveling as part of a Y Achievers program, which is part of the 8th Street Y, which is a college tour program for teens, and you'll hear a little bit more about that this evening. So again, thank you very much. We are very thrilled through the support that we have received from Unified Government for the last couple of years. We have been able to be very intentional about using funds and operating our Y in our main areas of focus around youth development, healthy living, and in social responsibility. And we'll talk specifically on what is it that we're doing at the 8th Street Y, but I wanted to just give you some statistics here to kind of start off with. Through our YMCA membership, and this is as of the end of 2014, December 2014, the 8th Street Y is serving 3,589 children, teens, and adults and seniors, and this represents 631 households. And again, this is as the end of 2014. As we checked our numbers today, that number is closer to 759. Very proud of the work that's being done there. These numbers represent data points that we're able to capture. There may be some other folks that we're serving whose names and addresses that we don't have in our database if we happen to be offering a community event where we're not capturing that type of information. 81% of these households in membership are receiving some sort of financial assistance from the Y, and this has increased dramatically over the last year or so. We've done very well in increasing the number of people that are utilizing the Y in services, but that's 81% that are receiving some sort of financial assistance. The median household of those individuals that we're serving in the 8th Street area, it represents $18,401, which is significantly below the national median household. And then finally, the representation of these members that are at the 8th Street Y is a very good representation of the community, both African American and Hispanic. Just happen to know that 47% of those members are Hispanic. We also wanted to give you a little idea of what's happening at the 8th Street Y, and having heard a little about what we presented last year, wanted to really kind of focus some of the attention is how is it that we've been leveraging the resources that we've been getting from the UG and what we've been able to do to be able to get some grant funding that really allows us to be able to do other things that you may typically think of us for as it relates to the building itself. So in hearing the discussion just a moment ago regarding the fetal deaths that are in this area, we're involved in a grant opportunity of around $81,000, which is our REACH program, which is a racial and ethnic approaches to community health. Would love to have some additional conversations with what we just heard about and how the Y might be able to play a more significant role, whether it's in educating or offering some programs and services to the Y to be able to move forward that effort. Would like to have a little further conversation about that. We're also doing the Young Achievers program, and you can see what that looks like. Joanna may spend a little bit more time talking about that. Also, our STEM program, science, technology, engineering, and math, early learning readiness, Salsa Sabor Y Salute, which is a healthy living program for those around nutrition and understanding diet and those type of programs. Then finally, an American Century program where we're receiving funding to provide a variety of programs at the 8th Street Y. If we were to look at our revenue sources, it's dominated by membership. There's no question about it. Nearly $400,000 of our revenue stream does come in the form of membership. The rest of it is through the UG funding that we receive, which represents 15%, followed by another 11% in grants. And I think that's the area in the grant area without your support, we would not be able to leverage those resources to be able to do those types of programs and services. So we do impact the community tremendously, and I'd like to turn it over to Joanna that can put some faces to some of the numbers that I've just discussed with you.
So what you're seeing right here is our back to school bash that we had last summer. We were able to serve 350 children. Each child went home with a backpack full of school supplies. We grilled out, had a healthy dinner for them all that night. Even in a torrential downpour, we were still standing outside under the tents, grilling. Each of those kids also received free haircuts to prepare them for their first day of school. And as you can see, face painting and a lot of other activities were involved in that event as well. We also have partnered with Harvesters and Family Conservancy to be able to offer cooking classes through kids cooking classes as well as adult cooking classes, where each week the families that participate in that go home with a bag of groceries as well. Help with the name of the class is actually Healthy Lifestyles on a Budget, so teaching them not only to eat healthy and be healthier in their cooking, but how to do it while maintaining a budget, family-friendly budget. We are also offering our Ready to Learn Early Learning Readiness program, and this is one of my favorite programs that we offer. It's free to the community, free to our members as well. Year-round program designed to improve school readiness for children ages 0 to 5 years old. It is a program that we offer with the children and the parents, so it's teaching not only getting the children prepared for school, but also teaching the parents how to help prepare their kids for school. So it's a great educational program all the way around. Also, we've partnered with the Girl Scouts, and that's some of our girls there. We host 3 age groups of troops at the 8th Street YMCA. That program is able to be offered for free, the cost is free to the girls. So with a combination of the subsidies that the Girl Scouts have received, as well as us offering the space for them to use it for free, so that eliminates their facility costs that they would normally have to do. And we, as you can see, they always have a really good time. So, and our leaders for that program are bilingual, so that we're able to offer the services to everybody. Night Courts. Night Courts is a program that we offered free to the community as well. We offered that this summer for teenagers from 12 to 18 years old. Every Friday night they were able to come together, work in leadership. They did have to participate in a leadership program before they were able to participate in the basketball program that came after that. In our summer session, we served 50 youth, and we also were able to offer that program again in the fall, where we were able to offer that program to another 45 youth. That was a great outcome with those programs as well. And along with that, as far as our teenagers, John mentioned earlier, we also offer the Young Achievers, which is a program to prepare kids for whatever comes after high school, whether that be college or whether that be straight into a career. We are preparing them for getting ready for whatever comes next. Part of that is the college tour, where we have 80 youth right now touring various colleges in Nashville, and I think they're all around down south this year, but we change that up every year. We do that twice a year. Also, our STEM program, which stands for Science, Technology, Engineering, and Math. With that, we offer a free kids camp every summer. We did a 2-week camp last summer. We plan to do the same this summer as well. With that, it's engaging kids, getting them more interested in science, making it fun. And we also have the robotics team, which is pictured there. And that was the tournament that they went to. They did medal. They had a great time. And that program is actually based out of Central Middle School. So it is a Y-funded program that we offer in the local school. And this is some photos from the camp that we had this past summer. Those that they're holding right there is they built their own roller coaster using or I'm sorry, no, that's a pinball machine. They built a pinball machine, and they were all very proud of that, using marbles and straws and toilet paper rolls and all kinds of crazy things to build that. The kids all had a great time. That was completely free to them, and that was free to the community, not just for members. Anybody could do that. And then our Salsa Sabor y Salud program is offered to Hispanic Latino families. The class is taught in Spanish, and this just is an all-around overall health and well-being program. So they go over everything from symptoms and what to check for breast cancer to what label reading when you're looking at the cereal box at the grocery store. So they go over everything that has to do with health and really helps the families get better. And we've served over 600 families in the Wyandotte County area in 2014 for that. And Scott will speak a little more on that.
With that is that, again, serving the families is one part of it. One very much measurable is over 4,000 pounds was actually lost during that period of time. Again, it's an 8-week program. It's really educating the entire family and really hopefully helping families understand. And, many of our country realize that we're in an epidemic right now as pre-diabetic, and really helping them to understand and reduce, and weight loss is a big part of that, and reducing that and blood pressure. So again, really realizing the importance of that and teaching it in a language that they feel comfortable with, being Spanish, and taught by our team that is a registered dietitian, which is spectacular.
And also what we're able to offer with your generous support is community events. So everything that's listed up there is something that we offer to the community. Those photos are from our Trunk or Treat event, where children are able to come have a safe environment where they can still celebrate, dress up, get in costumes, have a good time, but do it in a healthy and safe environment, so that they're not, just going to strangers' houses or, just pigging out on candy. We offer, apples and other things and toothbrushes, which they definitely didn't care for the toothbrushes, but we were glad to give them to them. And then just lots of good time. Also with our family nights, we offer family nights once a month. We do movie nights and various health fairs, senior activities. We do senior potlucks as well. Just a variety of community events, whatever we can do to really increase the participation and increase the overall health of our community.
These are the faces of those that you may not see every single day. And maybe the other ones that you may think that we're serving, which we do every single day, but these kids and families wouldn't be getting these types of services without the support from the unified government. There is additional information in your packet that provides even financial statements on how the H Street Y operated. We still understand that we, as a non-for-profit charitable organization, must be good stewards of those resources. Our funding request for this year is actually right around $11,000 less from a budget year perspective than what we received from the previous year, and around $17,000 in less capital expenditure related to the H Street Y. So I think we have been increasing the utilization of the services for the Y, and again, we can't thank you enough for this wonderful partnership and opportunity to work with the unified government. We're certainly open for your questions now.
Joe, this is probably a question for you rather than them. Why are we considering this separate from the budget process?
I think this was an opportunity to bring their presentation back. It was more of an update on because the year is up in April from when the funding was authorized. So this was brought back as an informational item from the 12-month period.
Didn't we, as a part of our last budget cycle, authorize money for 2015, April 2015?
Well,
didn't? Okay.
I'm filling in on this one, so I'm going to plead a little bit of ignorance, but I believe it was, but the budget was good until April of this year.
Okay.
So that's why we're bringing it back.
Well,
yeah, that's right.
well, originally, yeah, definitely originally it did, and we made a strategic decision then to stabilize it until we could have a long-term solution. The long-term solution is still kind of wrapped up in the plans and the progress of the Healthy Campus.
And it was renewed for that second year,
Right.
but at a lower amount. So this
And
is,
so-
this is the end of year 2.
Well, isn't the decision then to fund this in a way that gets them on cycle with all the other budget? I mean, I thought that was the commission's decision, rather than trying to fund items outside the budget process.
Well, I certainly think that would make a tremendous amount of sense, because otherwise, are we authorized to make budget revisions to 2015? Which effectively, I mean, this money is this money already encumbered somewhere? Or are we authorizing a budget revision to 2015?
Well, the money appears to be coming from Parks and Recreation, according to the,
10,000.
just 10,000.
Well, 65 from the 2015 budget, and then
Money has to be.
an additional 10 from 2016. That would normally go to
Here's the woman with
Parks
all
and Rec.
the answers.
Talk to us, ma'am.
How,
Tell us the
Welcome.
Hello, Debbie Johnsher, Assistant Finance Director. What we currently had in the budget, they had budgeted for 2014, they'd committed 25,000 of the 100,000 that we were receiving as the casino contribution from the Parks Fund. So currently, there's 25,000 in 2015 that is encumbered through April for the YMCA.
my question is, how much money have we taken from the Parks and Rec budget over the last couple of years to give to the YMCA?
In year one of the agreement, it was $10,000 per month, and I believe that agreement went from April of 2013 through April of 2014, and it was $10,000 per month. And we also funded a capital maintenance program at $2,500 per month. And when they renewed the agreement in 2014, the amount dropped to $6,250 per month. So we were funding $75,000 from April of 2014 through April of 2015.
But Debbie, was the funding source from that the first year of the Hollywood casinos, 100,000 that went to Parks and Rec?
That's correct, and so is the second year. That's where the second year also
These
came
weren't
from.
local general fund monies. These were outside funding sources for that.
Right. So,
However, it is budgeted in the parks
Yeah, it's part of the
general
parks
fund.
budget, but it's not local tax money.
right, and thank you for that, but I'm still looking for the ballpark number. I understand the $2,500 per month. I understand, 1,500 per month or whatever it is, but just a ballpark estimate of how much was supposed to go to Parks and Rec but went to the YMCA.
In the first year, it would have been the full 100,000, I believe, was utilized in the first year, and 75,000 in the second year. However, I guess it overlapped years because the agreement was done in April. It overlapped years, but for the 2 years, it would have been 175,000.
We can verify that
I can
amount, but
verify it.
I believe that's correct.
Okay.
Well, I would make a motion that we approve this funding, provided that we can make the amendment to the 2015 budget and authorize it for April of 2015, based on the fact, as I said earlier, that we are effectively still waiting the ultimate resolution of this, which is the inclusion of this into the community center that's planned as a part of the Healthy Campus.
What does that mean exactly?
Yeah.
And
That was sort of our sideline discussion is, Joe, it might be a nice time for us to have a presentation on what is going on with the Healthy Campus at a full commission meeting so that we can see these two sort of linked together, is what I'm thinking.
I would have to tell you that when we started this process a few months after I first became a commissioner, and we agreed to the funding mechanism for the new YMCA, I was under the impression that by this point we would have already broken ground. And I was very, I mean, this issue, oddly, either brings enthusiastic support from the constituents that approach me on it, or absolute objection to continuing to fund the YMCA. And it doesn't seem like there's any middle ground. I mean, I'm, you know, famous last words. I'm on record as saying I wouldn't vote for it again. And again, I thought, you know, somewhere down the road, we're gonna at least say we've got the new Y on the drawing board, or we have the plans and we're ready to break ground, and I mean, I don't feel comfortable. I've had a conversation with the mayor. I realize that this is a complex project that requires a lot of pieces to come together, but we cannot fund I don't believe we can justify continuing to take money from Parks and Recreation and other scarce resources to fund the Y with no visible due date on when that new Y is even going to start to be built. And that itself may take, I don't know how long, a year to build, a year and a half to build. I don't even know if they have do you have architectural plans for it yet?
Yeah, well, one thing I am able to tell you is I do know both the mayor and David Byrd, our CEO, have already been meeting on getting ready to go out and start looking at capital campaign and start raising funds in order to make this happen. I think it's part of the overall master plan for the healthy campus in order to build this structure. So I think the next phase of looking and finding and trying to secure those resources is already underway.
Joe, can we forward this to some kind of special session or full commission discussion without having to vote to approve or deny tonight? Can you just take back
Yes.
that we think the full commission needs to hear what's going on
Sure,
with how
absolutely.
that links together?
And can we roll that in with a report about the healthy campus?
Yeah.
Thank
Yep,
you.
that's-
Well, I think, I'm all for that, and I think that we need to do that soon, because obviously we've gotten ourselves in a situation where they are dependent, I assume, need the funding before the end of April. So that doesn't give us a lot of time, so I would urge you to urge the mayor, and I'm urging him by my statement here on TV, which maybe you'll watch tonight, to set up a special session on this so we can make a determination if we can actually fund it outside the budget process, and what it takes to get it back on a normal budget cycle, because I know there was this general feeling by all the commissioners for different issues that this sporadic funding of different things throughout the year comes due when we do the budget, and then
We all wish we had.
there is either buyer's remorse or whatever you want to characterize it at, that we went ahead and funded that at that time instead of waiting until we saw it in the big framework. So at a minimum, I would go along with funding it, and probably will, at least until the budget cycle makes a determination. But I think we should have a special session quickly and make a decision at that time as to what we can do.
And I'd like to say also that with the same passion and excitement that we move forward money for the YMCA, that when it comes budget session, that we possibly look at moving money into Parks and Rec where we can upgrade our facilities and do some of the things we need to our parks and all those kind of things. Because if we're speaking about constantly taking money away from Parks and Rec facilities or something of the sort, but at the same time, every budget session, we continue to dwindle the money that we give to the Parks and Rec department, that to me doesn't seesaw out evenly to me. So I love having more opportunities for young people and people to be healthy in this community, but I'd like to see it on both ends. And as a Unified Government Commissioner, I'm responsible to the voters who use Parks and Rec freely to enhance their health and things like that. So,
Commissioner Philbrook?
I remember a lot of the conversation, but some of it was kind of fuzzy by the time we got through talking about how this was going to go, the healthy campus. And I see the Y as definitely presented as an integral part of a healthy community. that I don't have any problem with. And I would like to see it part of it. I guess my concern runs right along with Commissioner Maddox and some of the others. Be careful now, Terrence, don't faint. That we do have, as we've talked before, about the opportunity for folks who cannot afford to have those memberships, that is worked into the budget, the new budget of what the Y would be about. And I know you guys have talked at length about that, I am sure. He's like going, uh-huh. I know that was probably part of the, uh-oh, how are we going to do this?
Yeah.
But
and as part of a committee, I know that we're meeting with in tandem with the other folks in the community to ensure that we are able to make it
provide that, so it is really part of a healthy campus that our community can take use of. So that's all I wanted to say about that. And so continue the hard work, and looking forward to hear an integral commentary from all involved. Thank you.
Mr. Connor, is that clear enough direction?
I get it.
Thank you guys very much for your presentation.
Great. Thank you for your attention.
Our last item consists of proposed changes to our HR guide. We always save the most exciting for last around here. Henry Couchman is here to present those proposed changes, and I see that Ms. Ramirez is with him.
Commissioners, Henry Couchman, Assistant Counsel. You have before you proposed changes to 7 human resources policies. The changes consist of kind of 2 groups of changes. One change would include sexual orientation and gender identity among the different types of behavior that the unified government would be prohibited from engaging in with regard to applicants for employment or employees. Similarly, the harassment in the workplace policy would be amended to include gender identity and sexual orientation, and prohibit harassment on the basis of either of those. The grievance procedure and the rules and discipline policy would likewise be amended in accord with the amendments to the EEO and harassment in the workplace policies. And finally, the social media policy would be amended to prohibit our employees from discriminating in their social media communications on the basis of sexual orientation and gender identity. The other 2 changes are to the definitions policy and the Family and Medical Leave Act policy. The definitions policy, there would be a new definition of spouse to make it clear that spouse includes same-sex spouses. That definition and the wording of that definition is taken from IRS and Department of Labor regulations. Basically defines a spouse or marriage according to the place of celebration. So if a marriage is entered into and it's legal where it was entered into, including a same-sex marriage, then we would recognize that as recognize those partners as spouses for the purposes of our policies. The FMLA definition comes directly out of the recent regulation adopted by the Department of Labor. It's very similar to the definition of spouse in the definition section, but it's somewhat different. I went ahead and went with the IRS regulation for spouse in the definition section because I think it's a little easier to understand and apply. But we'll use the FMLA definition for the FMLA policy. I'll be happy to answer any questions that you have on any of these changes.
Are there any questions?
Move approval.
Second. Sorry.
Roll call.
Roll call. Philbrook. Aye. McKiernan.
Aye.
Maddox.
Aye.
Walker.
Aye.
Aye. That was our final item for the evening. We're adjourned.